video is about cancer survivorship care plans, what you need to know. As a result of the increase in the number of people living with cancer, more healthcare providers are providing cancer survivorship care plans to their patients. But what are cancer survivorship care plans? Why are they important? What should you do if you've never received one? This video was prepared by the California Dialogue on Cancer, a coalition administered by the California Department of Public Health's Comprehensive Cancer Control Program, in partnership with Triage Cancer. This video will provide you with answers to these questions, along with resources to help you and your healthcare providers navigate your healthcare and other issues you may be facing after a cancer diagnosis. What is cancer survivorship? As of January 1st, 2014, there are more than 14.5 million cancer survivors in the United States. In the 1930s, less than 1 out of every 5 cancer patients were alive 5 years after treatment. Today, more than 3 out of 5 cancer patients will be alive 5 years after diagnosis and treatment. Improvements in early detection and treatment have resulted in more people surviving longer after being diagnosed with cancer. There are also survivors who live for extended periods of time with cancer as a chronic condition or as an advanced disease, receiving long-term treatment. The National Cancer Institute defines cancer survivorship as being from the time of diagnosis throughout life. Although the number of cancer survivors have increased, after the diagnosis and treatment of cancer, survivors and their families still face a host of physical, psychological, practical, and financial issues. In 2010, a Livestrong survey found that 98% of cancer survivors surveyed experienced a wide array of physical, emotional, and practical issues after a cancer diagnosis. However, only 58% of cancer survivors who experienced emotional concerns received help, and only 20% of those with practical concerns received help. Cancer survivorship care plans can help with these emotional and practical concerns, in addition to providing a treatment summary and follow-up care plan. Because your need for care does not end with your last day of treatment, a survivorship care plan can be a valuable tool. It gives you and your healthcare providers a guide to monitor and manage your ongoing care, and can also help you navigate any additional post-cancer care needs you may have. An effective cancer survivorship care plan is a written document that includes a summary of your treatment, recommendations for your follow-up care, and other relevant information to help you anticipate and address the long-term and late-term physical, psychosocial, practical, and financial effects of cancer treatment. Another goal of cancer survivorship care plans is to assist in the coordination and transition of your care from your oncology healthcare team to your primary care providers as oncology treatment is completed. You should provide a copy of your care plan to your primary care providers. Every cancer survivorship care plan should include medical and non-medical information to be the most effective in assisting you in navigating through the variety of cancer survivorship issues that may come up. Plans should include an introduction that describes to patients what the document is and how it can help them. Plans may also include an introduction for future healthcare providers. These are the parts to an effective survivorship care plan. A treatment summary includes the details of your cancer diagnosis, such as the date you were diagnosed, the type of cancer, stage, and any treatments that you received, such as chemotherapy, radiation, and surgery. It should also list the names and contact information of your healthcare providers and treatment facilities. A follow-up care plan includes specific recommendations for your ongoing care, possible signs of recurrence, and identifying and managing long-term and late-term side effects. It also gives you information on healthy living, such as smoking cessation and alcohol restrictions, nutrition and dietary modifications, regular physical activity and weight-bearing exercise, and immunizations. Cancer survivorship care plans should also include information about psychosocial issues that may be a challenge after a cancer diagnosis, such as effects on relationships, sexual functioning, parenting, genetic counseling, and spirituality. To be complete, survivorship care plans should also include information about practical issues, such as insurance coverage, employment, education, other legal issues, and the financial impact of cancer. And finally, a survivorship care plan should include a list of resources and referrals to cancer-related organizations, follow-up care providers, support groups, and other resources and information for survivors. How do you get a cancer survivorship care plan? The Commission on Cancer has an accreditation program for cancer programs across the country. And in order to get approved, cancer programs are required to start using cancer survivorship care plans. By January 1st, 2019, all cancer survivors should be receiving plans. Ask your healthcare team if they can provide you with a survivorship care plan. The facility where you receive treatment may have a survivorship clinic or program to assist you after your treatment ends, and may have a process set up to create a survivorship care plan for you. If they do not have a process, they could use the Journey Forward or ASCO survivorship care plan template. You can find these online, and the websites are listed in the resources at the end of this video. If your providers don't want to use these templates, you can ask your healthcare team if they know of a local survivorship clinic or program which can provide you with a survivorship care plan. If your healthcare team is not aware of a local survivorship clinic, you can check to see if there's a survivorship clinic in your area using OncoLink's online search tool. To look up cancer survivorship clinics in your area, visit www.oncolink.org/survivor/clinics. If there is not a clinic in your area, there are a few survivorship care plan templates that you can use to develop a plan for yourself with the use of your medical records. As medical records are often hard to read, you may want to ask a member of your healthcare team for help to complete your survivorship care plan. Some examples of these do-it-yourself plans include the Livestrong Care Plan, powered by Penn Medicine's OncoLink, which is an online tool meant for adult cancer survivors. It requires you to complete a brief questionnaire and then compiles a survivorship care plan for you to review and discuss with your healthcare team, including your oncology and primary care providers. Healthcare providers can also use this tool on behalf of their patients. It can be found at www.livestrongcareplan.org. Another plan is called What's Next? Life After Cancer Treatment, which is a survivorship care plan template developed by the Minnesota Cancer Alliance. It is written in lay language and helps you keep track of cancer treatment, manage your follow-up care, gain an awareness of side effects, have a dialogue with members of your healthcare team, and access resources to address physical, emotional, and practical issues. There is also a template called Journey Forward, My Care Plan. This template is for you to use to start your own survivorship care plan and to complete it with the help of your healthcare team. The template is available as a free mobile app on iOS and Android platforms, or as a printable PDF form. If you receive or pick a plan that focuses on the treatment summary and follow-up care, but doesn't include psychosocial and practical issues, then consider talking with a social worker or someone else on your healthcare team to get help with these other needs. Are there cancer survivorship care plans specific to you? There may be plans available to you based on the type of cancer you have, the language you speak, your ethnicity and culture, and your age. The American Society of Clinical Oncology, also known as ASCO, has developed survivorship care plan templates for survivors with different types of cancer, including breast cancer, colorectal cancer, non-small cell lung cancer, small cell lung cancer, prostate cancer, and diffuse large B-cell lymphoma. Some cancer programs have developed customized survivorship care plans for their patients as well. For example, the City of Hope has developed breast cancer survivorship care plans specific to Latinas, African Americans, and young adult breast cancer survivors. The Children's Oncology Group has developed survivorship guidelines for children, adolescents, and young adults. Passport for Care is an online tool currently in use in over 120 clinics and is available at no cost to Children's Oncology Group's member institutions. Ask your healthcare team if this plan template is available to you. When do you get a survivorship care plan? Although a cancer survivorship care plan can be used at any point during care, it's most common for patients to receive a plan when they complete treatment. Survivorship care plans can also be helpful for some patients who are receiving long-term treatment or have advanced cancer. It's important for you to talk with your healthcare team about when a survivorship care plan might be useful for you. The process to get a survivorship care plan usually includes a healthcare provider creating a plan for you, the provider meeting with you to give you the plan, explain the plan, and answer your questions, your healthcare provider sharing the plan with your primary care providers, and your healthcare team providing you with follow-up care based on the survivorship care plan. You can find more information about survivorship care and survivorship care plans from these resources: the California Dialogue on Cancer's Survivorship Care Plan Fact Sheets in English and Spanish, the American Cancer Society, the American Society of Clinical Oncology, the Children's Oncology Group, Journey Forward, the National Cancer Institute, and Triage Cancer. The California Dialogue on Cancer is a state cancer coalition administered by the California Department of Public Health's Comprehensive Cancer Control Plan. It includes state and local governments, private and nonprofit organizations, health, medical, and business communities, academic institutions, researchers, cancer survivors, caregivers, and advocates. CDOC helps to develop California's Comprehensive Cancer Control Plan, which aims to reduce the cancer burden in our state by suggesting activities to help control cancer, including prevention, early detection and screening, treatment, survivorship, quality of life, and end-of-life care. Triage Cancer is a nonprofit national organization that provides information and resources on cancer survivorship. It provides educational events, including seminars, teleconferences, webinars, and conferences across the country. It also provides resources and materials at www.triagecancer.org and hosts a National Speakers Bureau of experts and survivors for educational events across the country.